So we've completed, as I said, a pricing framework, which is our key policy document, in which we define the key parameters of efficiency, the criteria for block funding, and the scope of public hospitals. We've completed that document on the 28th of March, and we sent it to health ministers for a 45-day statutory period for comment. Under our legislation, we have to provide our reports to health ministers for 45 days. We've done that. Comments due today. Long night tonight for the team and I. But we will make some changes. We've already had a number of key points made to us that have indicated that the first document we produced needs to be changed. But we will then publish a pricing framework, as I said, hopefully early June, mid-June maybe at the latest, that describes all of those policy issues that we've taken into account in pricing. And we'll try and build on existing documents where we can, costing specifications and the like. In parallel, we've been doing a whole lot of technical work, which is a bit beyond me at times, and I won't bore you with today, but we've been doing a lot of detailed work around the statistical analysis of costs across the country. We've based ourselves on the National Hospital Cost Data Collection. It is the best data source that we have. It's not perfect, and it's come in for a lot of criticism, but it is by far the best, and it's fit for purpose, and we'll use it. It just perhaps is a salient reminder to you all, if you manage a LHN or a hospital or work in one, that the National Hospitals Cost Data Collection is a very important part of your work, and the more accurate you provide data, the more accurate the data you provide, the more likely is you'll get a reasonable outcome from us. In future years, we're not going to leave it this late. Obviously, we started on the 15th of December, so we had to produce the national efficient price as early as we could. We claim we did it by 28 March, but we will certainly sign it off by 30 June. In future years, we want to produce a draft, at least for health ministers to look at, by the 30th of November. So you've all got more time to prepare for the impact of that decision on Commonwealth funding and budgetary preparation. So how did we price? We've sent a price, as I said, we've sent a number to all the governments in Australia, none of which are happy with it. And we've sent a price, we set a price in the first year for 2012-13 based on a fairly, I wouldn't say gentle, but certainly planned introduction of national pricing. So we've set a price that's actually the mean cost per national weighted activity unit across Australia. So there's a bell curve distribution of costs of local hospital networks in Australia. We've trimmed some outliers and made some statistical adjustments, but in the end you come up with a mean, and that's where we've set the price. And some have argued on the Treasury side of our interactions with governments that that's too gentle, too soft. I think when Victoria commenced pricing in the mid-90s, they priced at the 25% quartile figure. We're going to price at the mean. So there is some debate about that, but I don't think it'll change in the coming weeks. We will still price at the mean. That means that around half, obvious, the maths is obvious, around half of the local hospital networks in Australia have to improve if they're going to operate at the national efficient price, which is in itself is a big challenge, particularly in some jurisdictions. It does mean that because we price at a national mean, that New South Wales, by force of numbers, tends to not set the mean, but certainly heavily influences the mean. And that's something that we'll have to consider later on in due course as to whether we should really price at the mean on account of that effect alone. But having said that, for 12-13, the authority members, the 9 of them, have decided to price at the mean. In itself, as I said, that's a challenge for many local hospital networks. We'll apply those adjustments that I spoke about earlier, those 3 adjustments, and I don't think we're going to consider any more. We haven't had any strong persuasive arguments yet for any other adjustments. And we'll set the quantum for those adjustments in the coming days as we get feedback from governments. Some of the governments are arguing around the quantum of those adjustments, and we'll do some work in the coming days to refine them if necessary. So we'll publish a price and a quantum for the adjustments in the coming weeks.